My name is Aldo. I'm from the Netherlands. I got my own practice, mainly doing orthopedics, and I'm following iselp to get comfortable with ultrasound and to get more knowledge of anatomy. It really helps me to get more knowledge and be more comfortable with my working up my clients. So besides the regular scanning of the tendons, what happens the most in veterinary practice, you learn a lot more about anatomy and functional anatomy of the total body of the horse, including scanning of joints and cervical spine. So it gives you a more complete possibility to check the horse. And have
you can do it.
Yeah, so yeah, the knowledge you get at iselp is focused on the practical use on the road. So you also get some knowledge about further investigation like MRI or CT, but the focus is really on clinical exam, ultrasound and X-ray. So yeah, you can use it really in your everyday practice doing orthopedics. Yeah, I think for me the structure of the course, so doing all the modules with the exam in the end, really motivates you to make a study of your profession. And you have to do all the modules and you have to work for at least 5 years before you can do the exam. I'm not that far yet, but it motivates me now to work to that point. And I really want to do it and get it. And it helps you in your profession.
Okay, hi, my name is Axel Wallman. I'm an orthopedic practitioner from Sweden, working at a clinic with 10 colleagues, and I'm only doing sport horse orthopedics. And I've decided to come to the iselp because I think it's a very useful way to have something that you can use directly when you come home from the courses. This is my 8th and last module, and I'm planning to take the exam next year, hopefully, if I manage. But I enjoy the courses and they're very useful in your everyday work. That's the biggest advantage for me. I have started to collect cases, but I haven't sent any in yet, but I have collected cases and started filming and documenting the cases.
This changed your way of working?
It changed a little bit the way I work. I use the ultrasound much more. I use it before doing the blocks and use it in, I would say at least 80% of the cases I use the ultrasound as a help to come to the right diagnosis.
We think that iselp is more than ultrasound. There's a lot of ultrasound.
It's a lot of ultrasound, but for sure, the biggest advantage is that you repeat all the anatomy, and you repeat the way you look at X-rays. So you just develop your skills. So absolutely, I agree. It's more than just ultrasound. It's really getting the whole picture of the orthopedic cases, which has been the bigger help for me.
Okay, good. Well, you already explained about your exam. It's doable. It's a lot of work.
Yeah.
But it's a fair exam.
Yeah.
So.
And it should be. It shouldn't be too easy because then it loses all the.
Sure.
I mean the quality of the exam. But if I don't make it next year, then I'll try again the year after.
Yeah, but that's also allowed. That's no problem. The benefit, in my opinion, was you do the course, and normally you do the course and then get home and then forget about it. Yeah. And then now you have to look at the DVDs again.
Exactly.
And think about what you learn.
That's for me as well. That's the biggest advantage to sit down and try to make the exam.
And do you have a sparring partner for doing the ultrasound?
Yeah. I have my boss here as well. So we went together. It's his 6th course, I think. So
you're going to win.
I'm going to win because I started before him.
Yeah, that's good.
It's my 3rd iselp here in Linghove. So it's great.
Yeah. Okay. Do you know already?
Yeah, I'm from Italy, and I do the iselp program because as.
Yeah. Sorry. Okay. Can you explain your name?
So I'm from Italy, and I attended the iselp modules just because I think that they are very useful to improve your skills on such, orthopedic and stuff. I think that it's very useful to do both the practical vet labs and then have so much, theory to study and to bring at home anyway.
What kind of clinic do you work?
I work at the university, and what we generally see is that surgical cases and then lameness, referred lameness. So anyway, we need to solve problems that maybe other people can't solve, and that's the deal.
Okay. How many courses did you take already?
I took 3 courses. One on neck and back, very useful. This one on the stifle, and the hind limb and eye suspensory, and was even very useful for me anyway.
Planning to do the next?
Yeah. I'm planning to do in the next few years, the rest of them, and then try to do the exam. It's not easy, but we keep trying,
Did it change your way of working?
It didn't change my way of working, but it changed my perspective on, orthopedical problems. You can see them in another way, after, after you can speak with this kind of people, like Dr. Denois or you guys anyway at the vet labs, It's useful, I think.
Yeah.
But I actually...
Especially filming.
Yeah, that's a huge problem for me anyway. I still have to change this side of my work, but it's useful to document every lameness and stuff, so you can keep recording it and maybe look at it the weeks after the examination, and maybe find a new input to understand it. Yeah, I actually come from a background where I wasn't used to, film or do or record and a lameness examination. Why now that I'm at the university since few months, and in the academia we always film things, and that's actually very useful. I agree with you that it can change your point of view anyway.
Francesca from Switzerland.
You work in a private practice?
Yes, I work in a private practice. It's mainly first opinion and orthopedic, and we got some referral orthopedic cases from other small practice around.
You do the iselp. Is it your first iselp?
No, it's my 4th. Okay. Yeah, so I did 4 before last year and this year as well.
You're going to do the exam?
Hopefully, yes. I collected a couple of cases already, so I would love to, but let's see.
Does it change your way of working?
The iselp, are you talking about? Yeah, definitely. Definitely.
Can you...
In which way it changed my way to work?
Yeah.
Well, I got way more knowledge. I'm going in depth with certain things that I was not used to use in terms of diagnostics, especially ultrasound. So it definitely improved the quality of my diagnostic, and I achieved better diagnosis, definitely. Especially higher up, so back problems, neck problem. I learned a lot, definitely. Yes, I will. I will recommend the courses. They are very well organized, very professional, and they're very intense. But definitely in 2 days you achieve, more knowledge and more information that you would do with other courses.
And do you intend to do the exam?
Yeah, I probably will. Not sure just yet, but that's the aim. I mean, I work in practice, so I don't have that much time to prepare the exam, but I would love to.
I work in practice too.
Yeah. No, I think the amount of courses per year is fine, because it's a good combination in between CPDs, especially for people that got like few days a year of CPDs. And also to have the time to metabolize the information. I think that is very important. So you can, with 2 or 3 or 4 courses a year, you have the time to review the information and not just get as many information as you can. I think it's a good combination. I definitely is is a good combination. Yeah, I wouldn't do more than what I do now, so like 3 per year.
Yeah.
Yeah.
Okay.